Rico has malocclusion. Open up, little buddy. He can't close his mouth all the way without his incisors hitting his lower palate. He's got double teeth here, which is a baby tooth and an adult tooth in a socket. Same thing there. Lots of overcrowding back here. And even at 10 months, our friend Rico has got some significant tartar already building up on those little back molars. First off, we have multi-parameter monitoring, which is one of the first steps when our patient goes under anesthesia, which measures our EKG, pulse rate, oxygen saturation, blood pressure, as well as temperature, so we can keep our patient comfortable during the process, as well as making sure that they're going to wake up. We also have this big blanket here, which is a warm air blanket that delivers warm air right on top of our patient. One of the side effects of many anesthesias and sedations are hypothermia, so we make sure to control their temperature and monitor it throughout the procedure. Throughout the procedure, we also monitor on our anesthesia sheets, which keeps a record of how our patient's doing, so we can notice trends of any highs or lows in any of his qualities, and we can take accurate action to take care of those. Also, we have the dental assessment chart, where we're able to keep record permanently in the patient's file of procedures done in the mouth, extractions, etc. We will also take full pictures of the mouth for our records as well, and for communication between our clients. In our clinical evaluation under anesthesia, one of the first things that I notice, aside from lots of crowding and some baby teeth that never fell out, is a missing first premolar right here. A lot of times first premolars have the habit of getting stuck beneath the gum line, and it can definitely cause us a lot of problems later in life if they're not addressed early. Okay, after cleaning, polishing, and fluoride, we now take a full mouth x-ray, which is a digital x-ray system that we don't charge our clients for. We feel that it's standard of care, so we do that on everybody that we have out for dentistry cleaning system. This patient in particular doesn't have a lot of plaque and tartar, but since he's under anesthesia and we're doing a dental evaluation, it's important for us to get the tartar that he does have off. We'll also do a light polishing and a little bit of fluoride to make sure that his enamel is as strong as it's supposed to be. Now I am actually filling out the dental record, or the dental assessment chart, marking missing teeth first off, second off charting the crowding that we see in the mouth, and which is very common in Shih Tzus and Lhasas or brachiocephalic dogs. We'll now take our periodontal probe and use it to measure the attachment of each tooth on all four sides, including its mobility score. Normal periodontal pocket depth for a dog is about 3 millimeters. Anything above that is considered a source of infection that we would like to treat in some way. Okay, Dr. Emerson, we have a 10-month-old Shih Tzu. We have multiple missing teeth, molars in the back, premolars in the front. One premolar on one side is retained, impacted, no cyst growth. Then we have molar 3 bilateral on the mandible that are missing, impacted with heavy cyst growth already. We have a supernumerary first premolar that's causing major crowding, as well as 4 retained deciduous teeth, canines that we knew that she was here for to begin with. Here I have the x-rays for you.
Oh, you got
why we take x-rays, right?
Look at that. Yeah, you'd never see that on a physical exam. So there's our tooth, and there's our cyst around here. Wow, you got bone loss here already as well from the crowding, a little tiny bit here. Did we put together a plan?
Yes, we have a plan together. Here's the additional, aside from the first estimate that we gave this morning, the 4 deciduous extractions of the canines are there already, so we can get to work on those while I continue to try to call the owner.
Okay. Okay. Can I get 11 blade, please?
Yeah. Here we go. This is Rico's mouth. First off, I started with his occlusion. We know that Shih Tzus have misaligned bites. Basically, they should come together like a scissor, much like this, and in his case, they're coming together like this. So these upper teeth were actually hitting right on the actual jawbone or the actual gingival tissue behind the lower inside all the way.
I noticed his bottom does come out a little bit further.
Yeah, and it's typical for the breed. However, as long as if it is causing harm, and in this case we can see that he's already starting to get what's called impingement, and these are what we also call cups lesions. These little cups lesions are also, right now they're not